For the health segment today, we're going to talk about a very important illness that some of us have battled with and are still struggling through it, trying to figure out how to heal from it. I'm talking about post-traumatic stress disorder. If you're going through it and you have any questions for Dr. Kelvin, don't hesitate to send them our way. The hashtag is Breakfast Daily, and the WhatsApp line is 0550585832. If you're outside Ghana, the country code is +233. So the topic again is post-traumatic stress disorder, and I have been joined by Dr. Kelvin Owusu, who is the medical director of Optimacare Diagnostics. Good morning.
Good morning.
How are you?
Very well, very
Thank
well.
you so much for being with us.
It's good to be here.
So post-traumatic stress disorder, what is it?
So let me start off by saying, first of all, that I am not a psychiatrist and I'm not a psychologist. However, I'm a general practitioner and we still have some experience with this aspect. So that's why I'm here today to share some insights about post-traumatic stress disorder. It's quite technical, but simply put, the name is quite self-explanatory. Post-traumatic stress disorder. Now, it's a mental health condition that's triggered by a traumatic experience. Now, this traumatic experience could be a personal, something you actually experienced. Somebody may have attacked you, may have, done something to you, or you may have heard something that has happened to somebody else. So it doesn't necessarily have to be something that happened to you specifically. It may have been an occurrence in the family. And then you have that experience, the post-traumatic stress disorder. Now, everybody goes through a negative experience in the course of their life. You may fail an exam, you may have a car accident, you may lose a loved one.
Break up.
Exactly. All these things can happen to everybody. However, not everybody progresses to have post-traumatic stress disorder. And that means that's kind of tells you that each and every one of us has a way of dealing with negative news or trauma. Each of us has ways and means of surviving trauma. Some people tend to go a bit overboard because probably how they are set up, how their system, how they process things. And as a result of that, they tend to get into the area where they cannot do anything about how they express the traumatic experience that they've had. And that's when they are said to have post-traumatic stress disorder.
So what are the signs and symptoms? So how do I know that right now I'm stressed out, but then I've now made it to the zone of PTSD?
Okay, so now another aspect you have to understand is, as I mentioned, everybody has experienced a negative event, but many of us are able to recover and go back to our normal way of doing things, able to return to work and function normally. A few who are not able to return to work or who are not able to return to normal functioning are the ones who are said to have post-traumatic stress disorder. Now, I'm saying this because a lot of the symptoms are general. I mean, if I said that you had thoughts of the event, everybody who has had a bad experience will definitely have thoughts about the event. But do those thoughts then interfere with your normal relationships? That's a question. And so when we talk about post-traumatic stress disorder, it's very difficult to say you have post-traumatic stress disorder. It begins with you yourself acknowledging that, okay, I'm overreacting to this thing that happened. It might have been a very significant thing. Let's say a lady has been raped by whoever. It's a big deal. I mean, to be raped is not something to be taken lightly. But then the question is, have there been rape victims who have been able to do this and that? And am I able to do the same things that they were able to do? If not, why am I not able to do it? Is it because maybe the rape resulted in some physical disability or something? If not, everything is fine. I'm a healthy young woman. I'm following the rape. Why am I not able to return to work? Why am I not able to have a normal relationship with a man after the rape? That means that there's something probably going on. You see, I'm trying to say this because post-traumatic stress disorder is quite, it's not an easy thing to categorically diagnose.
Okay, so one of the symptoms will be you react to certain triggers that may remind you of the trauma you experienced.
The symptoms have actually been grouped. So we have intrusive thoughts. Okay. So intrusive thoughts could be that you have had an experience, a traumatic experience, but these thoughts keep recurring when you don't want them to happen. And it doesn't have to be at the same time. So let's say you had a car accident 2 weeks ago. It's okay to think about it for the next 2 weeks, 1 month. It may even be okay to think about it for a year. But then now, 10 years later, you are not able to drive because once you sit in the car, you start getting thoughts about what happened 10 years before. that may not necessarily be normal, because so many people have had car accidents and they're able to return to drive. Why are you not able to drive? Because the thoughts keep coming back. So you've been raped before. Suddenly, every time a gentleman wants to become, wants to get intimate, you begin to remember the experience you had, with the rape. So it's preventing you from even having a normal relationship. Let's say you lost a loved one, a very close person. Suddenly, it prevents you from having or developing a close relationship with anybody else, because you are afraid that if you have a relationship with them, you will lose them. And so it's affecting your ability to bond with other people around you. These thoughts are not healthy. So intrusive thoughts are part of the symptoms. Also, we have the second group, which is called avoidance. So because you've had such an experience, you avoid anything that will make you even remember those things. So let's say you ate some food and then you had a terrible experience. Maybe you ate fish and then a fish bone got stuck in your throat, and it was a serious thing that required operation. Following that, you swear never to eat fish again, and suddenly when you even see fish, you begin to so you avoid anywhere that fish is mentioned. That is also not healthy, because the fact that you had an experience with a fish bone yesterday doesn't mean you have it today. But you are taking it a little too far. So these are a few of the symptoms. There are so many symptoms. In fact, they've categorized about 17 different symptoms. If you say we are talking about all the symptoms, we'll finish today. But that's why I keep saying that it comes back to the individual, because each and every one of us has experienced a negative event sometime in our lives. We were able to overcome it within this period of time or that period of time. Why is it that this particular thing, I'm not able to overcome it? Why am I avoiding people because of this thing I had? Why am I developing a fear of going outside because I had an accident 10 or 20 years ago? Why is it coming up now? And this is important because, especially in our culture, you see, when we talk about mental health, culture plays a role. And in our culture here, a lot of the things that we go through, we never actually allow people. So one, we don't allow people to deal with it, and they themselves don't deal with it in their own way, because we keep saying "Fama nyame." And so we sweep a lot of the things under the carpet without actually dealing with it, and it's a big deal. So I keep coming back to this issue of rape, because it is actually one of the major causes of PTSD, especially in our environment. Oftentimes we hear that young girls have been raped by a close relation, father, uncle, cousin. And because it's a family matter, we don't allow the girls to actually express themselves. They don't get the psychological help that they need to have. And so over time, they suppress these memories. Later on, especially when their children are younger, later on in the future, these thoughts come out and begin to express themselves in how they even have relationships. So now this girl suddenly becomes promiscuous, and we don't understand why she's becoming promiscuous, because that is her way. That is the experience is now manifesting in that attitude, Or this girl is not able to hold on a relationship at all, and we don't understand why. It's probably because that issue was not dealt with completely. Because we don't report the cases to the police or whoever. It's always hush-hush. So the children cannot even complain about what they went through, because you don't mention this outside the family. Meanwhile, in the family, there are no qualified people to help her to deal with this matter. So a lot of the experiences are suppressed. Say, for instance, let me use myself. So back in the day, I had my very first major car accident. This is like 10 years ago. It wasn't my fault per se, but after the accident, I actually could not drive for almost 2 months. Because I was afraid that if I sat behind the wheel, it would happen again. And then, when the accident happened, I was actually with a friend. My relationship with that friend actually didn't go so well, because I thought we were in the car together. So if I sit in the car with that person again, it might happen again. So that's my way of avoidance. So even though I was able to deal with it. Now, of course, now I'm driving and everything. That's because I had support from my family. So we were able to overcome it some way, somehow.
So beyond the medical support that you will need from a psychologist or a psychiatrist, you also need the family support.
Very, very important. Again, everybody has negative experience. Why is it that only you are having PTSD? So one of the risk factors for the development of PTSD is actually a lack of family support.
Lack of family support. So we'll continue talking about the risk factors and also preventive measures, as well as how to cure it. But I must say that we apologize if some of our viewers find this triggering, right? Because we are mentioning very sensitive things, car accidents, rape. So if any of the things we are mentioning may be triggering for you, we apologize, but we understand that we have to talk about these things. That's the only way we will heal as a society, right? And so if you know someone in your family going through it and everyone is pretending that the person isn't going through it, maybe this is the time to bring up this conversation. The hashtag to use, again, if you have any questions for us, is Breakfast Daily, and the WhatsApp line is 0550-585-832. If you're outside Ghana, the country code is +233. Now, Dr. Kelvin, how is that a factor, the fact that you don't have a family support? Because it could be that your mom went through it and she had to deal with it her own way. Your dad had an accident. He had to deal with it his own way. Why should you get any special attention?
So I actually like that where you're taking it from. Now, again, let me use not a personal experience, but I witnessed this myself. Now, female genital mutilation or female circumcision. Mm-hmm. The grandmothers have been through it. The mothers have been through it. So it's your turn, the daughter's turn. Now, I witnessed a lady who had the female circumcision. She had come into the clinic for a test. This test required us to X-ray or scan her uterus. Mm-hmm. It was such a terrible experience. Personally, I witnessed this, and it was very, very upsetting for me. When you touch this lady's thighs, she starts screaming, throwing everything, breaking things in the hall. But the test must be done in that area. But she will not allow anybody, whether male or female, to touch her so the test can be done. It took us so long, almost, in fact, she had to go home, come back the next day. It took us almost a week to get the test done. But as the time, we actually involved, a psychologist, and eventually the story actually came out that she had been circumcised at the age of 11 or thereabouts. And so now she was in the late 20s. And she was actually coming to have a test because she wasn't getting pregnant. But it turns out that the husband cannot even have access to do anything.
So how can she get pregnant?
Exactly. So technically, she wasn't getting pregnant not because she wasn't. It's not.
Do you have any medical issue?
We can't even tell because
you can't get access.
You can't even get access. And all this was because she had that traumatic experience of a female of being circumcised at that age, and that in her mind meant that anybody who attempted to touch her thighs was trying to do that same thing to her. And the reason why this was extended to even females could not touch her thigh because the people who did the circumcision were actually females.
Yeah.
So to her, no human being should even touch her thighs at all. And it was a very, 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 very... In fact, even I was traumatized by the experience, by witnessing how she was reacting to doctors. I mean, you'd have thought that doctors were
safe.
Yes. But no, nobody could touch this woman. It took us a week before we could do this. This test is just 5 minutes, literally just 5 minutes, and it took us a week to get it done.
Wow.
And that's just because this experience had been suppressed by the family because my mother, your mother has gone through it, your grandmother has gone through it, so who are you going to talk to? So when we talk about family support, we are not just saying that people around you, who I don't know how to put it. The people around you should be willing to help you overcome the challenge. Of course, they shouldn't be the ones who caused the problem in the first place. Mm-hmm. So, for instance, a father doesn't do things to a daughter and then expect the daughter to come back to the same father and then express to him what she's going through. It doesn't make sense. You cannot go to the source of the pain and tell the pain to help you heal the pain. It's even confusing as I'm saying now. So the family cannot be the same source of the problem and also attempt to give support for the person to overcome the problem. There needs to be some professional input into all these things. However, between realizing that your relative has a challenge and getting that relative to see a qualified person, there must be some support, some intervention from the family to encourage this person to actually go and get the support that they need. And of course, sometimes the experience may have been the entire family actually being exposed to that same thing. So again, let's go back to, let's say, a car accident. There are 5 people in the car, mother, father, children in the car. They all had the accident. Everybody has moved on and is living a normal life. But then one person, let's say a daughter, is now having issues with driving. She doesn't want to drive because of what happened in the past. Even though everybody was involved in that accident, that particular person is reacting to it differently. So you cannot just sit down and say that, but we all experience that thing. Why are you the only one having this issue? That statement is not a fair statement. Because like I said in the beginning, everybody deals with pain, deals with trauma differently. Even let's take something as basic as a cut on your hand. Both of us may have been cut at the same place at the same time. We will not necessarily heal at the same rate.
So speaking of healing, how do we get to the path where we are healing?
Again, it all depends on the individual.
Okay.
First of all, you must identify that there's an issue, because you may have had a breakup with your boyfriend or whoever a few years ago. You had no issue. You've had a second breakup. Why is this particular breakup affecting you so much? So you must recognize that this one is different from what you had experienced before. You may have had an accident several times, but why is this particular accident causing you to have this different kind of reaction that's affecting you, your sociability, your productivity? Everything is being affected. Then, so you need to identify that there's a problem. If you are failing to identify that there's a problem, this is where the family comes in. The family should know that there's something going on. Why is this person suddenly not taking care of her hair? Why is this person becoming so irritable? We are talking about something so basic, and suddenly this woman is irritable and ready to fight everybody. Why is this guy suddenly drinking so much alcohol? Why is he smoking? Why is he?
Because it could be a call for help.
Yes, exactly. It could be a call for help.
Yeah.
So the family should also be able to notice these things. Now, when you notice these things, usually the first thing most people will do is try and talk to this person to get him or her out of the thing. But it's not working. It's been a couple of years. This person is not making progress at work. In fact, he or she is not even able to maintain work. You don't sit there and keep talking to the person hoping that there will be a change. No. There are professionals who are trained to help these kind of people, and they are available in Ghana. Unfortunately, and this is where it gets a bit difficult, there's a lot of stigma
with mental health.
Of course, the institution has not helped, because, I mean, so for instance, you have Accra Psychiatric Hospital.
You even go there and the state.
Exactly. But thankfully, there are a lot of interventions going on. And even currently in Kolebu, there's actually a special unit dedicated to mental health, so that you can actually go there and get the help that you need, because you need professional help from the psychologist and the psychiatrist. Now, most of the time, the initial stages is handled by the psychologist, because it's all about cognitive self-awareness. You need to understand that you have a problem, and then you yourself will deal with the problem from your mind out.
How important is it to start from the psychologist? Because in our environment, we try to pray the pain away or pray the problems away. And you might have a child who prayers might not work because they need to see a professional.
You see, that's in the Bible. Even Luke was a physician. So, I mean, the praying doesn't necessarily replace the work of the doctor. And secondly, you can pray anywhere. You can pray in every situation. The problem or the issue is that many of us, we put prayer and the medicine on parallel lines. The two of them can intersect, and so let the person go and see the medical person, while at the same time you continue with the prayer. Because, I mean, God works in mysterious ways. He could work through the doctor to get your child or whoever it is to recover. And so prayer does not replace the need for intervention by the psychologist. And secondly, the psychological intervention most of the time does not even require medication. Because, like I said, it's about cognition. You yourself recognize that this is the issue. Then they will take you through protocols and techniques to help you bring yourself out of that situation. When those things are not working, or maybe you went to them too late, then they would involve the medication to try and maybe, so for instance, some of the consequences of PTSD, that's post-traumatic stress disorder, is depression or anxiety.
Yeah.
It can actually tip in.
Maybe sometimes you have a panic attack and you don't know where it's coming from.
And so if you come in with severe depression, obviously you would need some medical intervention to bring you up so that you can even understand what the psychologist is trying to help you achieve. And so most of the time, psychologists and psychiatrists work hand in hand. Okay. But again, the stigma, the fact that they are called psychiatrists doesn't mean that they only work with mad people. No. And this is why you realize that in the West, in America, in the UK, they call them shrinks. They are one of the most highest paid medical practitioners, because everybody or a lot of people have recognized how important a role they play in our lives. And so almost everybody goes to see their psychologist or their psychiatrist.
It's a normal thing. It's just like coming to see you in
exactly,
the hospital.
And so we need to try as much as possible to dispel the stigma, so that people can seek help. Because most of the people with mental health issues are not getting the support they need from home.
And they're hiding it.
And a lot of people are keeping up appearances. So you realize that just out of the blue, somebody may just flare up, and then you have no idea what is going on.
Or commit suicide.
You're
like, what a shock.
Exactly.
But there's nothing shocking
about it. But there were
about
signs. But because many of us are not even aware of the signs, we don't even know what happened, and the person just commits suicide, and then everybody is sad. And the interesting thing is that because of that person's suicide they committed, somebody else could develop PTSD. And so the cycle...
But then you are blaming yourself.
Exactly. So then the cycle continues, and it's not broken, and then it continues, and then it becomes a big deal. Well, it is actually a big deal in Ghana now, because there are a lot of people with mental health issues who are not getting the help they need. Not because the help is not available. The help is available, but the stigma is preventing them from accessing the help. So we really, this is something that we really have to talk about and get people to be aware that it is manageable. Yeah. It is manageable. And people have had a lot of traumatic experience and have gone on to achieve a lot of good things for humanity in general. And so the fact that you had a terrible experience, an accident, anything like that, doesn't necessarily mean the end of you. You can still achieve a lot if only you got the help that you need. And the help is available.
Thank you very much, Dr. Kelvin Owusu, for being with us. Where do we follow you on social media?
Well, on Facebook, I'm Kelvin Owusu, MD.
Thank you. And there you have it, okay? So PTSD is manageable, and there's no shame to it. I've battled with PTSD myself. I've seen a therapist. It's an ongoing thing that you have to deal with to heal as a person. So if you have a family member or a friend and they are going through it, be there for them. Help them get the solution they need. But don't make it look as though there's some stigma or they are crazy because they are battling with mental health. It's a part of the process. It's like every other illness, like a headache or malaria, and it can be treated.
We hope you've enjoyed the show. Make sure you subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.